So without any further ado, it's my great pleasure to announce our first speaker. The first talk will be given by Luc Ingenbliek. Luc is a very international character, I would say. Belgian national, born in Senegal, grew up in Switzerland and France, and graduated in biochemistry in food science and technology. And he has a PhD in public health obtained in France. Luc coordinated the first regional total diet study in sub-Saharan Africa, which was supported by Pasteur, FAO, and WHO. The project involved the processing of food consumption data of more than 70,000 households, as well as sampling and analysis of nearly 900 chemicals. This is really impressive numbers. Since December 2021, Luc joined the WHO headquarters as technical officer, where he supports the generation and use of dietary data within the Nutrition and Food Safety Department. Luc, we are looking very much forward to your presentation about the role of TDS in the GEMS food program, aims and objectives of the workshop.
Thank you very much. Good morning, everyone. I hope you're well. It's very nice to be able to see you in person. Some of you I haven't seen for a while, and some I see for the first time today. So, yes, this presentation will be about the GEMS Food Program, which is managed by the WHO, but also the role of total diet studies. So basically, that will be the introduction to this meeting. So let's talk about the Nutrition and Food Safety Department at the WHO. So this is the result of a merger of two departments working on nutrition and food safety. So the vision of the department is a world free from all forms of malnutrition and foodborne disease, which will be supported by societies having safe and supportive, which are supportive and promote healthy environments. So we are working with member states, and this is one of the reasons why we had last week a tutorial which was conducted online, and we had 14 countries, 14 participants who were very active and learned about conducting total diet studies. So definitely the work that we do is to improve people's lives, and this is possible by having a certain level of leadership, by setting norms, providing guidelines and policies, and also supporting country actions in particular activities in relation to monitoring and surveillance. So I would like to give you a warm welcome on this conference. This is not the first conference. And I remember that 2 years ago, I was supposed to travel to come here to Berlin, and this was not possible because of COVID. So here we are. So some of you could make it, and some of you joined remotely. I just want to think about our colleagues who are now retired, Jerry Moy and Philippe Verger, who are not able to join us today, but they were very active at WHO to support total diet studies. So let's talk about the GEMS Food Program. So GEMS means Global Environmental Monitoring and Surveillance System. And it was launched in 1976. So the purpose of the GEMS Food Program is to share data and method to support the provision of scientific advice. So the databases of the GEMS program support the provision of scientific advice to the Codex Alimentarius. In this way, they help setting international food standards, and to a certain extent, the ambition is to contributing to the estimation of the burden of foodborne diseases. So with that, the GEMS Food Program has food consumption data, and I mean individual food consumption data from a number of countries, a lot of analytical results, which describe or reflect the occurrence of a large number of chemicals in the foods. And the GEMS Food Program also has a roster of exposure experts and a network of GEMS recognized institutions who are sharing their expertise and experiences about monitoring food chemicals and also conducting food consumption survey and contributing to dietary exposure. So let's talk about dietary exposure. So this is fairly simple. Most of you already know that, and it's very basic, but this is just to remind that we need food consumption data and data of the concentration of chemicals in the food. And of course, there are different levels of quality of those data, which is something that we will be discussing. And of course, it is very important to adjust this by body weight in order to compare it with health-based guidance values. So when we're talking about food consumption data and which data to use, we need to bear in mind what is the purpose of the assessment. What time of food consumption do you need for the purpose you have, but also what is already available. So it's very important not to reinvent the wheel. Let's talk about lifetime dietary exposure assessment. So that concerns chemicals with a very long half-life and chemicals accumulating in the body, such as persistent organic pollutants. And we can also think about very long exposure, which could only have an effect at a very, very long term. So let's say lifetime exposure, like radionuclides in the case of an incident. So the most basic proxy for food consumption data would be based on the food balance sheets. So the food balance sheets are compiled by the Food and Agriculture Organization of the United Nations, and basically they come up with an estimate which is reflecting the availability at national level of the food. So in order to make it simple, it's about the food production plus what you import, and you remove what you export to other countries, and the food loss and waste. And this is per capita, which means that it is not a very precise assessment, and it has a lot of limitation. Nonetheless, the WHO has come up with a GEMS food cluster diet, which divides the world into 17 dietary clusters, which can be used for some long-term and lifetime exposure assessments. And of course, there are lots of limitations with the use of these data, but at least there is a full coverage of the world. So this is how the GEMS food cluster diets are represented. So you have, for example, the cluster G09, which include a number of countries based on their dietary patterns. So now, if we're talking about shorter than lifetime dietary exposure, or let's say chronic exposure, we will be able to compare it with, for example, a health-based guidance value, such as an acceptable daily intake, a tolerable weekly intake, or something like that. So it is expected that the effects will occur after several months or years. And for example, this could be used to assess dietary exposure of children to methylmercury, or the dietary exposure of adults to arsenic, and the relationship to skin cancer, for example. If we want to conduct that type of assessments, it would be necessary to access individual quantitative food consumption data, which are a better reflection of the usual intake if we include multiple 24-hour recalls of food records. And in this case, the difference is very significant in terms of assessment, because the individuals are characterized by their age, their sex, and their body weight. And ideally, unfortunately, that's not always the case, these surveys should be nationally representative. So I'm just going back to the example of one example of deterministic dietary exposure assessment or point estimate, where you are using, for example, it can be another distribution parameter, but you could use the mean food consumption and multiply by the mean or median chemical concentration. Let's talk about the CIFOCOS. So CIFOCOS means Chronic Individual Food Consumption Summary Statistics, which is hosted by the WHO and includes data from many countries. It is an always evolving number of countries, of course, but it's true that the progress in coverage of the data sets is slow because of the lack of recent surveys, or also because sometimes it is difficult to obtain the data from the countries. So the foods are mapped with the FoodX2, and it includes distribution parameters of the food consumption, including the mean, the standard deviation, high and low percentiles for consumer groups by age and sex. And you can access it through the FOSCOLAB application, the link of which is here. So you also have visualization from the FOSCOLAB, so the Food Safety Collaborative Platform, where you can access and visualize the food consumption of countries. So if you're going to conduct a probabilistic dietary exposure assessment, which can be done either for acute or chronic effect, most of the time it's done for acute exposure, the issue is that it is sometimes resource intensive, but it is useful in order to assess a very realistic assessment of the exposure of the population. So, of course, in that case, you need to have the distribution of both the consumption and the contamination of the food. I would like to mention also the GIFT platform, which is the Global Individual Food Consumption Data Tool, which includes more and more countries. These data sets give the microdata, which is different from the summary statistics that you have in the CIFOCOS. So these data are transferred automatically to the CIFOCOS platform, provided that they have at least 2 24-hour recalls, at least 2 days of surveys. So if there's only 1 day, they would not be included. I want also to mention the GEMS Food food contamination data. It's a database which includes already about 8 million data points. And of course, more data are needed because even though 8 million seems a lot, but there are lots of chemicals and there are lots of foods, and it's a monitoring which is continuous. So in order to be able to assess trend, or even to do an assessment, we need more data. But also we note that from low and medium income countries, there is a certain lack of data that is unfortunate. And we are trying to change that. So with these kind of workshops, with those kinds of tutorials and experience sharing exercises, we are trying to improve that. So now let's talk about the limitations. And I think you understood that I'm not a big fan of the clustered diets. And I think for dietary exposure assessments, it is understandable. It is definitely an expression of the availability, and it is not food consumed. So, of course, we need to be very aware of the limitations that it implies when we are performing an assessment. It doesn't reflect the variations of some countries compared to the others within the same cluster. It doesn't reflect the consumption, for example, of children who typically eat much more per kilogram of body weight because they need to ensure their growth. It doesn't reflect the situation of women of childbearing age who can be more at risk for some of the endpoints. Well, now if we're looking at individual food consumption data, of course, there are different quality levels in those surveys. Sometimes they are representative, and sometimes they are nationally representative, but that is not always the case. And we also need to be very well aware that conducting those studies is not easy, and it relies on the memory of the survey participants, which means that it is possible to introduce some biases due to that, but it's even worse if it is a record, because this can also induce a response bias where the participants do not eat something because they want to give the right answer. They don't want to be judged. So that sort of bias is also something that we might need to take into consideration, but I would say this is probably the best we can come up with. So there are not so many recent data sets, but of course we are chasing them and trying to include them in the GIFT platform and to have them in the CIFOR so that they can be used for nutritional and food safety assessments. But of course, more data would be very, very important. So, key messages. So whenever a dietary exposure assessment needs to be conducted, it's very important to determine the purpose. So sometimes the nature of the health-based guidance values with which you will compare your exposure will be useful. Of course, it is important to collect all this information, and this is what total diet studies are contributing to. And I believe that it is probably the best reflection of the actual intake of nutrients and hazards that we can come up with. But of course, you need to decide which questions you want to answer and which approach is the most suited to what you want to achieve, but also to the availability of your data and the resources that you can access. Because, of course, you should not be, let's say, blocked by the lack of resources. There's always a place to start with, and I very much encourage you to resort to a stepwise approach where you start with whatever you have and then try to improve. And of course, communicating between risk assessors, the ones conducting the dietary surveys, and the risk managers is very important within the agency and across agencies. And we can even say internationally, and this is what we are trying to achieve with this meeting. So just to remind for those who are not familiar with total diet studies that the specificity of total diet studies is that a large portion of the diet is covered, and this portion should be representative. So typically more than 90% of the diet by weight. And another important feature is that the foods are prepared as consumed, and the fact that the samples are pooled before they are analyzed. A very important message is also that total diet study cover not only hazards but also nutrients, so it could be very interesting to do both if you're conducting a total diet study and not to choose only one of these. And finally, there are important references which I recommend. First, the EFSA, FAO, and WHO guidance called Towards a Harmonized Total Diet Study Approach, a guidance document. I think it is very good. It is very useful. And there is also the book from Jerry Moy and Richard Van Oort on total diet studies. It's very useful. And I also recommend that you take a look at it. So before finishing this speech, I would just like to go back through the agenda of the sessions. So I've just finished mine, and I think I'm well ahead of time. So we will be able to go to the coffee break if Chair agrees with that. And then we will have a presentation of the wonderful BFR meal study. It's the first German total diet study, but probably one of the best in the world. And then we will be able to listen to Professor Wongying Wu, who will explain the Chinese experience of conducting total diet studies. So after lunch, because the Czech total diet study will not be covered, we have changed the agenda, and we will talk about the Portuguese TDS, then the Canadian one, and we will go to the poster presentations. Tomorrow, we will have 3 sessions on the Australian, African, and Italian total diet studies in the morning, and in the afternoon, we will have 4, the French total diet study that Véronique Siro will present, the TDS in Korea, in the US, and the methodology and design of the first total diet study in Riyadh, which we very much look forward to hear. So this is it for the introduction. I think it was enough for the purpose. So I really much look forward to the discussions. And thank you, Chair. Over to you.